If you've recently found out that you're pregnant, congratulations. And chances are you might be wondering what happens next. Well, to put your mind at ease, here's everything you need to know about the first trimester of pregnancy, baby development, mom's body changes, and much more. So let's get into it. The first trimester of pregnancy lasts from the first day of your last menstrual period, LMP, which is counted as day 1 up to and including week 12. To calculate your due date, you can use the following formula: LMP minus 3 months plus 7 days. However, keep in mind that this is just an estimate, and your actual due date will depend on factors such as your cycle length. It's important to note that most pregnancies last between 38 and 42 weeks, calculated from the first day of your LMP. During the first trimester, several significant events take place, marking the beginning of your baby's development. Let's take a closer look at what happens week by week, weeks 1 to 4. During this time, the egg travels down the fallopian tube after being released during ovulation and meets the sperm. If healthy sperm meet the egg at the right time, one lucky sperm can actually fertilize the egg. After fertilization, the cell divides rapidly and forms a ball of cells known as the blastocyst. This structure then implants into the lining of the uterus, where it will continue to grow and develop over the next few weeks. As the blastocyst implants, the placenta and umbilical cord begin to form, and the neural tube, which will eventually become the brain and spinal cord, starts developing. This is a critical time for your baby's development, and any exposure to alcohol, tobacco, or harmful substances can have a negative impact. That's why it's important to maintain a healthy lifestyle during this stage. Most women won't show any signs of pregnancy at this point, since the HCG hormone isn't produced in sufficient quantities until the embryo implants. Some women may experience very light bleeding when the embryo implants. If the bleeding continues, or you notice any large clots, contact your healthcare provider immediately. Weeks 5 to 8. As the embryo continues to grow, major organs such as the heart, lungs, and kidneys begin to take shape. Limb buds appear, which will eventually develop into arms and legs. Facial features such as the eyes, ears, and nose start to form. The head and brain also grow rapidly during this time. By the end of the 8th week, the embryo is about 1 inch long and has a distinct human appearance. Many women still don't show any obvious signs of pregnancy at this stage. However, some may start to experience early pregnancy symptoms such as morning sickness, breast tenderness, or frequent urination. The embryo is still very fragile, so it's important to avoid any potential harm during this time. Weeks 9 to 12. Your baby now has distinct human features, including arms, legs, fingers, and toes. The internal organs are functioning and the baby can move, although the mother won't be able to feel it yet. The fetus is covered in downy body hair called lanugo, which helps regulate temperature and protect the delicate skin. By the end of the first trimester, the fetus is approximately 3 inches long and weighs about 1 ounce. You may still experience morning sickness, but some women find that it starts to subside around week 12. Other common symptoms during this time include food cravings, mood swings, and increased sensitivity to smells. The uterus is still growing, but it's still relatively small and hidden behind the pubic bone. However, many women start showing signs of pregnancy by the end of the first trimester. Throughout the first trimester, it's essential to prioritize your health and well-being to ensure the best possible start for your baby. Now that we've talked about your baby's development, let's shift our focus to the changes happening in your body. As the pregnancy progresses, your body undergoes various transformations to support the growth and development of your baby. Here are some of the key changes to expect during the first trimester. Hormonal adjustments. In early pregnancy, the body produces high levels of hormones such as progesterone and human chorionic gonadotropin, HCG. These hormones play a vital role in maintaining the pregnancy and supporting the developing baby. However, they can also contribute to symptoms like fatigue, nausea, and breast tenderness. Fatigue is a common symptom during the first trimester due to the significant hormonal changes and the increased demand on the mother's body. To combat fatigue, it's important to get plenty of rest, eat a balanced diet, and stay hydrated. Nausea and vomiting, commonly known as morning sickness, can affect pregnant women throughout the day, not just in the morning. While the exact cause of morning sickness is unknown, it's believed to be related to hormonal changes. To alleviate these symptoms, try eating small, frequent meals, staying hydrated, and getting fresh air. Breast tenderness occurs because of hormonal changes that cause the breast tissues to prepare for milk production. To find relief, wear comfortable clothing, use a supportive bra, and consider applying warm compresses. In addition to these common changes, your body will also undergo other adjustments to accommodate the growing baby. These include changes to your reproductive system, digestive system, cardiovascular system, and immune system. Now, let's talk nutrition and lifestyle. Maintaining a healthy lifestyle is crucial during pregnancy to support both your well-being and the development of your baby. Here are some key areas to focus on during the first trimester. Folic acid. Folic acid is a B vitamin that's essential for preventing birth defects such as neural tube defects. It's recommended to take a prenatal vitamin with at least 400 micrograms of folic acid daily. You can also obtain folic acid through foods like green leafy vegetables, beans, and citrus fruits. However, it's important to note that prenatal vitamins typically contain higher amounts of folic acid, so they may be necessary to meet the recommended daily intake. Balanced diet. During the first trimester, it's essential to focus on a balanced diet rich in fruits, vegetables, lean proteins, whole grains, and dairy products. This will provide the necessary nutrients for your baby's development and support your overall health. Fruits and vegetables are packed with vitamins, minerals, and fiber and should make up a significant portion of your diet. Choose a variety of colorful produce to ensure you're getting a range of nutrients. Lean protein sources such as chicken, fish, beans, and tofu provide essential amino acids for your baby's growth. Whole grains like brown rice, quinoa, and oats offer fiber and carbohydrates for energy. Dairy products like yogurt, cheese, and milk are excellent sources of calcium and vitamin D, which are crucial for your baby's skeletal development. Hydration. Staying hydrated is crucial during pregnancy. Drink plenty of water throughout the day to maintain proper hydration. Adequate water intake supports blood circulation, nutrient transport, and waste removal from the body. It's generally recommended to drink at least 8 cups of water per day, but individual needs may vary. You can also consume water-rich fruits and vegetables like watermelon and cucumber to contribute to your daily intake. Exercise. Regular exercise is beneficial for both the mother and baby during pregnancy. However, it's important to choose appropriate activities. Brisk walking is an excellent option as it provides cardiovascular benefits without excessive strain. Prenatal yoga or swimming are also great choices for maintaining flexibility and reducing stress. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Remember to consult with your healthcare provider before starting any new exercise program during pregnancy. As you navigate through the first trimester, it's important to stay proactive about your medical care. Attending regular prenatal appointments and undergoing recommended screenings can help ensure the well-being of both you and your baby. Prenatal visits. It's crucial to schedule regular checkups with your healthcare provider throughout your pregnancy. During these visits, your blood pressure and weight will be monitored, and your healthcare provider will assess your overall health and the progress of your pregnancy. Additionally, they'll perform an abdominal exam to assess the baby's position and growth. It's also an opportunity for you to ask any questions or discuss any concerns you may have about your pregnancy or baby's development. The frequency of prenatal visits may vary, but generally it's recommended to see your healthcare provider at least once a month during the first 2 trimesters and more frequently as your due date approaches. Screenings. Early pregnancy screenings can provide valuable insights into your baby's health and development. One common screening is the first trimester combined test, which involves a blood test and ultrasound to assess the risk of genetic conditions such as Down syndrome. Another screening is the anatomy scan, typically performed during the second trimester, which allows for a detailed examination of your baby's physical features and organs. These screenings are important because they help identify any potential issues early on, allowing for timely intervention or further testing if necessary. However, it's important to remember that screenings are not diagnostic and they may not always be accurate. As you navigate through the first trimester, it's natural to have questions or concerns about your pregnancy. Don't hesitate to reach out to your healthcare provider or a trusted resource like Mother and Baby for guidance and support. Remember that every pregnancy is unique, and there's a lot to look forward to in this exciting journey. And that's a wrap on the first trimester of pregnancy. We hope this video provided you with valuable insights into what to expect during this crucial time. Don't forget to like and share if you found it helpful. Until next time, happy parenting.